My patient today presents with unilateral arm pain, and the pain goes down through the shoulder and into the arm, and she does have some pain in her neck. So I'm hypothesizing that she has cervical radiculopathy because she does have some numbness and tingling. So the first test I'm going to do is range of motion for the cervical rotation, and this will help me realize if I should continue to hypothesize cervical radiculopathy, because I should see some reduced range of motion on the affected side. So to start, I want to find the acromion, and that's going to be in line with my proximal arm. Axis rotation will be center of the cranium, and distal moving arm will be in line with the parallel with the nose. All right, so I'll have you rotate to your right. And she got about 60 degrees, so we come back to neutral. And 60 degrees is normal.
The first one's called valgus instability.
Now we're going to do the left.
If there is instability,
all right, so now I'll have you rotate to your left.
Roll in the medial collateral ligament injury.
And this one was about 43 degrees. Did you have pain with going to the left? Okay. So the left would be an empty infield, and was there pain on the right? No. Then the right would be a firm infield. My next test is an MMT, and I will be doing cervical extension. It is common to have some weakness with the neck extensors with cervical radiculopathy. So that's why I'm going to do this test. It'll help me guide my treatment to see if we need to do some neck extensor training and strengthening as well. So my one hand is going to stabilize the thorax to help prevent extra extension through there. And now I'm going to have my patient extend her neck up, back, perfect. She has full range, so now I'm going to apply some resistance. And she breaks immediate on resistance, so she would have a grade 3. The first special test I'm going to do is the Sperling's test, and this has a high specificity to rule in cervical radiculopathy. So I'm going to use that to help confirm my hypothesis. So first we're going to test the unaffected side, so I'm going to have you flex your head forward, and then we're going to rotate to the right, and then I'm going to apply some overpressure. Any pain with that? No? Good. Okay, so now we're going to flex your head forward, and then we're going to turn towards the involved side, and then I'm going to apply some more overpressure. Ow. Did that put any numbness through your arm? Yes. All right, so that test would be positive and could rule in cervical radiculopathy. The second special test that I'm going to do is the upper limb tension test, which tests the median nerve. So first I'm going to use the patient's unaffected side. So I'm going to bring her shoulder out into 90 and support it with my leg, and then I'm going to block at the top of the scapula as well, and fully externally rotate her arm, and then extend her wrist back, and then slowly extend out at her elbow. You feel any pain at all? Good. All right, so this one was negative for her unaffected side. And I'm going to have you scoot over to this side. All right, same thing for the affected side, so we're going to go out to 90. Fully externally rotate. Extend the wrist. And now I want you to tell me if you feel any symptoms as I slowly extend out your elbow. Yeah. You feel it right there? Yeah. All right, so then to confirm, you can have your patient look. So can you look over your right? Does that increase your symptoms? Good. Okay, can you look towards me? Does that decrease it? Yeah. Okay, good. So that would be a positive test, and that would also support the cervical radiculopathy. By doing manual muscle tests, we'll be able to determine which muscles are weak and need to be strengthened for this patient. Using Sperling's and upper limb tension tests, we can educate the patient based on which positions provoke their symptoms and how to avoid further provocation. We can also use this to guide our treatment by doing cervical traction. Since we know that the upper limb tension test was positive, we could do cervical traction to attempt to improve those radiating symptoms. And we could also use this to put those tissues on slack. And then once the tissues are reduced in irritability, we can use manipulations to improve their mobility and reduce pain. And also with the upper limb tension test, we can use it to incorporate upper quarter nerve mobilizations.